So hello everybody and welcome to our Black Health Improvement discussion. So I'm here with Faye and also Charles from an organisation called CARN, and that stands for the Caribbean and African Health Network here in Greater Manchester. My name's Natasha Odita and I am a primary care Workforce Programme Manager based at Greater Manchester Health and Social Care Partnership. Welcome everyone. So Faye, Charles, can I just ask you to introduce yourselves, please?
Yeah, hi, thanks Natasha. My name's Faye Bruce and I'm the Chair for the Caribbean and African Health Network in Greater Manchester. I am one of many things, but particularly focused around health inequalities within the Black community. I've done a lot of work in that area and hence this piece of work is really, really important to me.
Thank you, Faye. Charles?
Hi everyone, I'm Charles Coco, the Chief Officer of the Caribbean and African Health Network, CARN. And I've been Chief Officer over the last 3 years plus. And among other things, I'm a church leader in an African majority church. I also co-chair the Faith Network for Manchester. So I have a real passion for working with people of all faiths and none, but also very much focus on racial justice and equality. Thank you.
Thank you. So I suppose we're here to talk about BHIP, or the Black Health Improvement Programme. So can you give me a little bit of background as to what it is? Faye, do you think you could answer that?
Yeah, definitely. So BHIP really was kind of developed because of what the Caribbean and African people were actually telling us about their engagement with primary care, not feeling as though that they were getting the best out of primary care. And what we do know is that the Caribbean and African community is the second largest non-white group in Greater Manchester. And unfortunately for Black people in Greater Manchester, we have some of the worst health outcomes across a number of health measures. And what we wanted to do is to bring the concerns of the community to the Greater Manchester Health and Social Care Partnership to identify a number of different ways in which they can improve some of that engagement with the Caribbean and African community. So we looked particularly across the high prevalence areas such as mental health disorders, cardiovascular related diseases, some cancers, and lots of other things. And obviously to add to that now, we've got the higher risk of COVID-19. So despite the disparity, the Black, African and Caribbean community are least likely to engage with mainstream services. And we want to change that by working with primary care. And within CARN, our vision is to eradicate health inequalities within a generation. Very ambitious, but we're going to use this framework to help us to develop that and to bring some kind of education, training and support for primary care.
Wow, that's wonderful. Thanks, Faye. So I wonder if I could go over to Charles then. Could you tell me a little bit about the aim of BHIP?
So BHIP aims to provide GPs and their staff with the tools and knowledge and insight in order for them to be better placed in engaging with their Caribbean and African patients, which ultimately will lead to better health outcomes. So, trying to, address some of the concerns Faye mentioned earlier on. Some of the objectives within the Black Health Improvement Program include a learning framework that delivers culturally appropriate training for primary care staff. BHIP will also be providing educational resources that improves the experience of the Black community. BHIP has a curriculum that can be used as a guide for further education or ongoing training and development. But also as part of BHIP, you will provide, primary care with the support they need and also help them signpost to other Black-led services within our community.
Oh, okay. So in terms of the programme then, I wonder, Faye, if you could just tell me a little bit more about what the programme includes.
Okay, so it's a quality assured programme that can significantly improve the quality of patient care and experience and improve access and engagement. And in order for us to do that, what we've included in this package is a 1 hour taught culturally appropriate engagement programme. So this is delivered to primary care online currently. We also provide access to a bank of videos and audio materials across specific and prevalent health conditions found in the Black community. And we also provide a range of communications to equip primary care with information that helps them to present themselves visibly as a practice that engages the Black community. So we also have a helpline as well that will be offered to primary care, so you can use that to signpost your patients if you've got any particular queries, to signpost them to us, and then we could signpost them onto appropriate services that we think that your patients will benefit from.
What a wonderful initiative. Charles, can I ask, I've heard that this sort of programme is accredited. Could you explain a little bit more about that accreditation, please?
So within BHIP, after the training, there will be a self-assessment undertaken by each primary, each surgery. So, as part of BHIP, in addition to the training, there will be a self-assessment undertaken by the practice, and the accreditation will be one of 4 categories. So we've got bronze, which is developing, and you can see a bit of information up there. And then the second level will be enabling, and then that will be followed by gold, which is establishing, and then the final category will be platinum, which is achieved. And just to say that following the assessment by the practice, you will be placed in one of these 4 categories with a list of recommendations to help, practice move to the next stage. So our commitment is to work with your practice until you get to the platinum or achieved stage.
Thank you. So I think I'm going to ask you this question, Charles. So what difference do you think BHIP is going to make to GP practices and also to the Black community?
BHIP will improve relationship between, GP practices and the Caribbean and African community. What we've seen pre-COVID and during COVID is the deep lack of trust. And also we've been aware of many years of delayed presentation because of how our Black community feels they are treated when they engage with services, hence the delayed presentation. So what we're hoping, by the time a practice undergoes the 1-hour virtual training in 2021, has access to the various podcasts that we are developing, resources including visual posters that they can display in their practice, one of the 4 categories, accreditation, that they can pin to their walls, and with ongoing support, the helpline where they could ring us for advice, as well as helping them engage better with their patients. We hoping that eventually will improve the health outcome. So it's improving the relationship where Caribbean and African people, as they engage with primary care, feel they listen to, feel they can be open with their GPs, and then they will eventually give a positive customer satisfaction from the service they have from their GP practices.
Absolutely, yeah, I can see how that can support. Okay, so I think the last question really that I want to know is, how do GP practices then sign up to this marvellous service? What do they need to do?
So there'll be you'll see this popping up on the site shortly. There'll be a registration form for practices to complete, and then we will receive that and then add them to the list so we can get underway the programme for them.
That's wonderful. Do you know what? I know you're both busy people, so thank you so much for taking the time to talk to me today and, you know, helping me to delve in and understand a little bit more about what the Black Health Improvement Programme is and ultimately how it's going to support and benefit GP practices and the population of Greater Manchester. Thank you.
Thank you.